The first case recorded, I don't have the direct date, but it's 2 weeks ago.
And any children among these positive cases?
Between the ages of 13, from 13 up. Presently, they're at home. They're at home. What we've done, we choose special houses and clear out families from it and place those people who've been positive in different houses that we clear out. For instance, we have in Batavia, families live in groups, right? We have a set of family in one area who has been infected, and we have other family in another area that has been affected. So these two families, what we've done in that area have like 10 houses. So they clear out 2 houses in one area to house that set of positive cases, which is in one area. Presently, I think is 14 cases in one area. So we have set aside houses to isolate those people. Right now, we don't have resources. The midwife, she is positive. One of the nurse, our health worker is in Middle Mazaruni. He should be back. I don't know when as yet, but presently we don't have no health worker or no health officer in the village because both of the health personnel in the village are positive with the virus right now.
Okay. So who is treating the patients?
Well, the doctors from Bartica come and visit them, and otherwise to that, the people from in the area have relatives in the Northwest area, Muruka, for example, that recommended the bush medicine. So most of them taking that kind of medicine right now. They're using a lot of ginger, lime, and other bush medicine. Batavia is approximately 5 miles from Bartica. And the main transportation is by boat. You can only get here by boat.
And I understand you're going on the full lockdown too.
Yes, presently we are in a lockdown.
When did it start?
Pardon me?
When did the lockdown start?
On Wednesday.
And how long it's gonna last?
For 2 weeks.
2 weeks.
Yes.
Is there any other pending test results that you're waiting on? If you can say how many?
Yeah, we have 7 more that we're waiting on presently.
So how often the doctors from Bartica go into Batavia to check the patients?
Well, to my knowing, it's like once a week.
So who looks after them during this time? Themselves or?
What we've done, we have family members, right? We get some protective gears from Red Cross. So we get some family members to actually prepare meals for them and take it to them, but we're not allowing them to go too close.
Anything else you'd like to say?
Well, I met with some of the. I went and visited the isolation area this morning, and I spoke with them, and most of them are saying that for now things are a bit normal. Some of the persons from around the area that goes out face up with a lot of discrimination. That is one. And they actually wondering where help would come after now because nobody can't work. In some of the families, husband and wife test positive, so both of them are at home. They can't go out and work. So they're asking me where would help come from and what best we can do for them. So I assure them that we would get in contact with the Ministry of Indigenous Peoples Affairs. We already I already spoke with Minister Gail Teixeira over WhatsApp, and I also talked with the officers of Region 7 at the Regional Democratic Council and NTC. Well, the National Toshao Council has donated 30 hampers for us recently, and we distribute that to the people who been affected and some others who can't afford to maintain their family.